The CEOs of Amazon, Berkshire Hathaway, and JP Morgan Chase want to fix healthcare. Their new venture will start with employer-based health insurance, where nearly half of all Americans get their coverage. But it's expensive. Family coverage costs $18,000 per year before out-of-pocket expenses. It needs to be fixed. These CEOs want to think big. Let's invite them to dinner to talk about their own coverage. But like any health insurance program, our table has rules. So let's see if we can help them think big. Mr. Bezos and his family are covered by his employer, Amazon. What if he's not the CEO, but a warehouse worker, making $14 per hour? In Seattle, his family may qualify for Medicaid, which covers about 70 million low-income and disabled Americans at an average cost of $8,000 per person. His basic benefits would include hospitalization, office visits, and emergency care. He might also get prescription drugs. But as Medicaid recipients, Mr. Bezos and his family are subject to different rules, so he'll need to dine at another table. Mr. Buffett of Berkshire Hathaway is probably enrolled in Medicare. Medicare covers the nearly 20% of Americans who are 65 years of age and older at $12,000 per year. During open enrollment, Mr. Buffett can choose traditional Medicare and a drug plan, or buy a MedAdvantage plan to control his costs. He may not live on a fixed income, but many seniors do. As a Medicare beneficiary, he's subject to different rules, so he'll be having dinner at a third table. At JP Morgan Chase, Mr. Diamond has several options and tools to help him make an informed choice. But if he were to retire now, at 60-ish, how will he be covered? First, he'll buy into COBRA through his employer, and when it expires, he'll be eligible for Obamacare, which covers about 12 million Americans. Mr. Diamond won't qualify for subsidies, but he'll be able to shop on the New York State marketplace for a plan. As an Obamacare enrollee, he'll need to dine at a fourth table. The United States has 4 health insurance programs: employer, Medicaid, Medicare, and Obamacare. One's job, income, age, and circumstances determine which program and rules apply to an individual consumer. These CEOs want to do something big. What if they made one system for all Americans, like Switzerland, which spends 12% of its GDP on healthcare compared to 18% in the United States? Now that would be big. I'm Colleen Murphy with ClareFolio. Thank you.